Hello, everyone. My name is Leah Fournier. This is my informational interview with Dr. Clifford Lane, the Clinical Research and Special Projects Director at the National Institute of Allergy and Infectious Diseases, NIAID. I became interested in interviewing Dr. Lane when I was searching for public health professionals with a strong clinical background. He has an active role in investigating viral pathogenesis and also has a particular emphasis on high-consequence organisms and developing cutting-edge treatments, something that I would like to do one day. Fresh from completing his medical doctorate at the University of Michigan, he began his medical fellowship at the National Institute of Health, the primary federal agency for performing and evaluating medical research in Bethesda, Maryland. Here he worked as a research associate in the same immunoregulation lab that former chief medical advisor to the president, Dr. Anthony Fauci, started in as lab chief. From there, he ascended the ranks both within the Institute and the U.S. Public Health Service Commission Corps, as he pioneered research and treatment of HIV in its early days of emergence. In the mid-2000s, when AIDS was actively decimating the South African troops that the U.S. had been funding for continental peacekeeping missions, Dr. Lane was called in to assist in establishing an antiviral research department from scratch in the country. Ultimately, his research helped persuade the current South African president, Thabo Mbeki, that AIDS was more than just an opportunistic pathogen that preyed on the poor and malnourished, and is in actuality a living, tangible agent. This experience also afforded him various governmental contacts that offered him a foot in the door for establishing further clinical research departments during the 2014 West African and 2018 Zaire Ebola outbreaks. As an additional note of interest, if there are any other readers out there, while introducing myself to Dr. Lane, I mentioned how my topical interest became piqued after reading The Hot Zone. This is a true account of the U.S.'s near miss with catastrophe when Ebola arrested and ravaged a monkey population in Virginia. Thankfully, there was no crossover. However, in this book and now TV adaptation, Dr. Peter Jarling had a pivotal role in identifying and then controlling the spread of the new strain. This book was also the general basis for the 1995 movie Outbreak with Dustin Hoffman. Dr. Layton recounts how Dr. Jarling shared with him, while Dustin Hoffman was researching his role, he reached out to Dr. Jarling, and his wife thought it was a prank call and almost hung up on him. The NIH is comprised of 27 separate but linked sister centers, roughly half of which contain clinical programs. Some of the other well-known affiliations include the National Institute of Mental Health, the Center for Scientific Review, the National Institute on Minority Health and Health Disparities, and the National Library of Medicine. Because of this, there isn't really any specific target population, but rather every center or institute generally tends to address or monitor a particular disease, disparity, hazard, accessibility issue, or other condition requiring quality improvement. In terms of Dr. Lane's work specifically, it most closely aligns with Essential Public Health Services 1 and 2, assessing and monitoring population health, and investigating, diagnosing, and addressing health hazards and their root causes. NIAID's mission statement is to conduct and support basic and applied research to better understand, treat, and ultimately prevent infectious, immunologic, and allergic diseases. And then, as you can see, the clinical research department's vision is very similar. Although my entire interview was extremely intriguing, I found two of Dr. Lane's sentiments to be particularly memorable. When asked about his numerous deployment experiences, his advice for an aspiring field epidemiologist is to listen carefully, never assume that you know anything when responding in another region or country. If at all possible, deploy with someone from the same area, someone who's familiar with the area's culture, dialect, political views, powers, traditions. He says, view yourself as a guest in someone else's house and allow the new environment to teach you before attempting to imprint upon it. Make sure that your crew feels appropriately cared for, in addition to making the experience run more smoothly. This also maximizes team motivation, engagement, and empowerment. In response to the question, what lessons were learned responding to AIDS and Ebola that lended to the recent federal monkeypox response, he emphasized how important it is to remember that just because you are in the midst of a particularly lethal outbreak, the rules and ethical considerations of research do not change. While it can be tempting to try and cut corners when lives are being lost, he states that the best practice for establishing the most effective interventions available to the greatest number of people in the shortest amount of time is by performing a proper randomized control trial. He offered the example of not fully considering confounding variables, hypothesizing that an invalid investigational agent such as water is an effective treatment for lowering Ebola fatalities. If at the end of the study statistics show that water ingestion reduces mortality by 50%, it will be falsely concluded that water cures Ebola when realistically outcomes improved as the result of having access to definitive care and institutionalized monitoring. In closing, here are my cited references. Special thank you to Dr. Lane and his associate Tria Carver for making this interview possible and connecting me with not just Dr. Jarling's information, but for also putting me in contact with the current NIH Integrated Research Facility Director of Fort Detrick's Biosafety Level 4 Lab, Dr. Connie Smalljohn.